welcome to my another video. So in the anesthesia pharmacology section, we'll be now discussing about the neuromuscular blocking drugs. They are also known as muscle relaxants. So let's start our topic. So they are either benzyl isoquinolines or aminosteroids. I repeat, they are either benzyl isoquinolines or aminosteroids. Please keep this point in mind. Now, mostly contraction of adductor pollicis muscle by ulnar nerve stimulation is used to assess their effect, that either it's complete or incomplete. They are classified as depolarizing and non-depolarizing muscle relaxants. So there are generally two types of muscle relaxants: depolarizing muscle relaxants and the non-depolarizing muscle relaxants. So let's look at the other points too. And now here comes the pharmacokinetics of the muscle relaxants. So here the first point mentions that they are highly ionized water soluble compounds, and due to that nature of the muscle relaxants, they do not cross the blood brain barrier, and hence the CNS effects are zero. Means due to their hydrophilicity, they can't cross the blood brain barrier. Now, not highly bound to plasma proteins, so they are very rapidly excreted out from the body. So the muscle relaxants are not highly bound to the plasma proteins, and for that purpose they are very easily and very rapidly excreted from the body. Now the other point, the rate of disappearance is characterized by rapid initial decline and then gradual decline from the body. Enhancement of block or enhancement of muscle relaxant occurs whenever these drugs are used concomitantly with the volatile anesthetics. I repeat, enhancement of block or enhancement of muscle relaxant occurs whenever these drugs are used concomitantly with the volatile anesthetics. And now let's look at the sequence in which the muscle relaxation takes place. So first of all, it affects the eyes, then digits before the trunk and abdomen, and finally the intercostal muscles and diaphragm. And the recovery occurs in the reverse order. I repeat, the sequence in which the muscle relaxation takes place is: first it affects the eyes, then digits, then trunk, then abdomen, and finally intercostal muscles and the diaphragm. And the recovery from this phenomena occurs in the reverse order. So please have a note of it. Now let's look at the classification of the muscle relaxants. So I already talked about the classification that there are two types of muscle relaxants: the depolarizing muscle relaxants and the non-depolarizing muscle relaxants. So let's look at them one by one. Under the depolarizing muscle relaxants class, the example includes succinylcholine. Then under the non-depolarizing section, there can be three types of non-depolarizing muscle relaxants action. In long-acting category, there are three drugs: pancuronium, doxacuronium and pipecuronium. Then in the intermediate acting section, there are atracurium, rocuronium, vecuronium and cis-atracurium. And finally in the short acting category, there is mivacurium. So please have a note of it. And now let's look at the depolarizing and non-depolarizing muscle relaxants one by one. So at first, the depolarizing muscle relaxants. Succinylcholine is the only clinically used depolarizing muscle relaxant. Then it is rapid and short duration of action. I repeat, succinylcholine is the only clinically used depolarizing muscle relaxant. It is rapid and has a short duration of action. Then it is a useful drug to facilitate tracheal intubation. I hope so it is clear. Now let's look at the mechanism of action. Of the depolarizing muscle relaxants, that is succinylcholine. So the mechanism of action is by two ways, that is phase 1 block or the phase 2 block. So now let's look at the phase 1 block. So phase 1 block is competitive antagonist of acetylcholine. So what happens is that succinylcholine attaches to alpha subunits of the nicotinic receptors mimicking acetylcholine. They depolarize the receptor, thus making acetylcholine unable to bind with the receptor, and hence the effect of the ACH is decreased. I repeat, succinylcholine attaches to the alpha subunits of the nicotinic receptors mimicking acetylcholine. They depolarize the receptor, thus making acetylcholine unable to bind with receptor, and hence the effect of acetylcholine is decreased. The hydrolysis of succinylcholine is slow as compared to the acetylcholine, thus producing sustained depolarization. I repeat, the hydrolysis of SCH, that is succinylcholine, is slow as compared to ACH, thus producing sustained depolarization. Release of potassium from the channels, thus causing hyperkalemia. So I hope these points are clear to you. Now let's look at the phase 2 block. The phase 2 block, whenever receptors are desensitized, scoline again binds to the same receptors, causing ion channel blockade and entrance to skeletal muscles. I repeat, whenever receptors are desensitized, scoline again binds to the same receptors, thus causing ion channel blockade and entrance to skeletal muscles. Let's look at the characteristics of the phase 1 block. As I mentioned earlier, that phase 1 block is competitive antagonist of acetylcholine. So there is decreased contraction in response to single twitch. There is decrease in amplitude but sustained response to the continuous stimulation. There is absent post-tetanic facilitation and the TOF ratio is greater than 0.7. Marked a star over here, that augmentation of block by anticholinesterase drug. So what does this point mean actually, and why have I marked a star over here? Because this is the most important point from the exam point of view, and the meaning of this point is that if the patient is under the influence of phase 1 block of succinylcholine, and if we administer anticholinesterase drug to that patient, then there will be enhancement of the block rather than reducing it. So this augmentation of block occurs when we give anticholinesterase drug before the patient come out of scoline, and this is the most important point. I repeat, please keep this point in mind, that augmentation of block by anticholinesterase drug occurs over here because succinylcholine is a depolarizing muscle relaxant. Now let's look at the characteristics of the phase 2 block. There is decreased twitch response to single stimulus, and there is unsustained response to continuous stimulation. So I repeat, there is decreased twitch response to single stimulus and there is unsustained response to continuous stimulation, and this is the only difference between the phase 1 and phase 2 block. The TOF ratio is smaller than 0.7. There is post-tetanic potentiation. Then the antagonism by anticholinesterase drug. In phase 2 the block will be antagonized if we give anticholinesterase drug, but in case of phase 1 it was not happening. So there was augmentation of the block if we administered the patient with anticholinesterase drug. So these are the few differences between the phase 1 and the phase 2 block. Let's look at the duration of action of succinylcholine. So depending on the following factors, the duration of action of scoline varies. So the first point, plasma cholinesterase activity, that is PCA. So if the PCA decreases, that is the plasma cholinesterase activity decreases, then there is long duration of action of succinylcholine. And if there is increase in PCA, that is plasma cholinesterase activity, then there is short duration of action of scoline. I repeat, if there is increase in plasma cholinesterase activity, there is short duration of action of SCH, that is choline, and if there is decrease in the plasma cholinesterase activity, then there is long duration of action of the succinylcholine. And this is the most important point from the exam point of view, and questions will definitely be asked from this section. So please keep this point in mind, that Because succinylcholine is metabolized by the plasma cholinesterase at the action site, it is called as the depolarizing muscle relaxant. That is, it doesn't require any other anticholinesterase drug to be administered peripherally to depolarize or its action to be reversed. I repeat, if there is decrease in the plasma cholinesterase level, that is plasma cholinesterase activity, there is long duration of action of succinylcholine. If there is increase in the PCA level, there is short duration of action of succinylcholine, because choline is metabolized by plasma cholinesterase at the action site. Hence it is called the depolarizing muscle relaxant. And what does that mean actually? It means that choline doesn't require any other anticholinesterase drug to be administered peripherally to reverse its action. I hope it is clear. And the second point, in presence of atypical cholinesterase. So there is prolonged action of the succinylcholine in presence of atypical cholinesterase. Now let's look at the side effects of choline. There is hyperkalemia, there is myoglobinuria, raised intracranial pressure is there. So in case of neuro patients, we need to use succinylcholine very cautiously, isn't it? The fourth point, there is raised IOP, that is intraocular pressure. So choline is contraindicated in generally ophthalmic surgeries. Then cardiac arrhythmias. The last and the most important point, that if there is sustained skeletal muscle contractions or sustained skeletal muscles rigidity even after giving this choline, then the patient is definitely suffering from malignant hyperthermia. I repeat, if there is sustained skeletal muscle contractions even after giving choline, that is succinylcholine SCH, then patient is definitely suffering from malignant hyperthermia. I hope it is clear now. So for this lecture, I will stop here now, because if I try to cover all the points here, then it will be quite boring, isn't it? So let's finish this lecture over here. I hope you enjoyed it. So in the next lecture, we will continue our topic of discussion. So in this lecture, we discussed about the depolarizing muscle relaxant succinylcholine. In the next module, we will discuss about the non-depolarizing muscle relaxants, one by one. Okay, it's already very late actually. I have to leave for my gym now because of my powerlifting session. So see you guys, you keep revising. I will go to gym now. Bye bye.